And she didn't know how to tell me, actually, because she knew that I might react to that. She was actually probably a little worried about telling me. And my reaction to that would be like worsening depression. Like I would sort of go to our room and like seclude myself. And so she told me that, and she told me, I said to her that time, I said, I don't have a choice. All day, all these things are happening. It's so stressful. When I come home, this is when I'm allowed to do these things, complain or whatever. I'm allowed to be this way. And then that's when she asked me, she said, how is it fair that the people you supposedly love the most get the worst version of you?
You have more power over your health than what you've been told. This is the Healthy Lifestyle Solutions podcast. I'm Maya Acosta, and I'm passionate about finding healthy lifestyle solutions to support optimal human health. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life and increase longevity in a big way. Let's get started. Well, and I have with me today Dr. Rak, and it's spelled R-A-K. Welcome, Dr. Rak.
Right. Well, thank you. Thank you, Maya, so much for having me on. It's awesome.
Yeah. So I'm interested in having a conversation with you about your story. I know that you're a physician that promotes lifestyle medicine. I met you in person in Orlando at the Lifestyle Medicine Conference, and you're now working with Dr. Lori Marbas, who has a new group named Mora. So let's introduce you to my listeners. Tell us a little bit about it. By the way, feel free to start wherever you'd like, but I would love to know how you became a physician interested in lifestyle medicine.
Okay. I guess there's two parts to that question. How did I become a physician? And then how did I become interested in lifestyle medicine? Mm-hmm. And the physician part is, well, I like to say, I'm every immigrant parents' dream. I went in, immigrants come to this country. It's hard to come to this country. It's hard to get into this country. Why do so many people want to come here even to this day? Because there's these opportunities, particularly education. My parents had that front and center in their head. They're like, we want him to get a good education. And my mom especially had it front and center, like, oh, it would be wonderful if he became a doctor. So I remember when I was a kid, there's this really small, I guess I like played doctor and said, but at a certain age, like 11, 12, 13, like hearing that, I was just like, that's the last thing I want to do. Right. Like leave me alone. And so I seriously, for a few years, as I got older, like it got to the point in college, applying for college. And there are these like combined medicine programs, where you can go to undergrad and medical schools combined 7 or 8 years. I was, I guess, interested enough in going into medicine that I applied to some of those programs. And like I got into our state program, and my parents were so excited. They were so thrilled. They were like, this is it. You're going to do it. And I was very honest with them. I said, I haven't made that decision. I don't know if that's what I want to do. It's something I'm now like open to. When I was in high school, I really, really gravitated towards sciences, but I also gravitated towards, I would say, like connection and debate in some ways. I didn't do debate, but I did Model United Nations. And so I got to college and I said, okay, I'll be pre-med. And half the school, I think, wants to be pre-med. And then every year it drops by half. So by the time you graduate, it's like, it's still a lot. It's like 10%, but it goes down a lot every year. So you take chemistry, organic chemistry, these kinds of classes. And then I had an advisor in college who said, I said, how do I make this decision? I wasn't sure what I wanted to do. And she said, well, one, the biggest thing is you have to ask yourself, do you enjoy, I don't know if she said enjoy, do you find enjoyment in taking care of people who are sick? Does that feel good to you? Because it doesn't feel good to everyone. Some people don't want to be immersed in an environment where lots of people are sick. And so I said, well, I need to find that out. And so I did a few things. I said, what can I do in terms of courses to learn sort of more the human side of medicine? So there were like offerings in like cultural anthropology, for example, on death and dying. So I took that class when in 2011, during September 11th. I actually went to class that morning. It was a couple hours later. I went to class that morning. Only a few of us showed up. I don't know why. I knew there was no class, but I just felt like we processed that morning. It was very interesting. But in that class, I also volunteered with the hospital chaplain. And I used to go that semester once a week. I used to go with the chaplain around the hospital praying with people. And Duke is I don't even know the denomination, but it's in the South. There are a lot of religious people. It wasn't just of Christian faiths. Like we would pray with people of Islamic faith. We would pray with people from Buddhist faith. You know, so many people come there because it's a big academic medical center. So that was really cool. It was really powerful. And I was like, you know, there's a really like strong energy in this room. I know there's a lot of anxiety, but there's really strong energy. I could feel it back then. I also volunteered at the cancer center, and it was like a navigator position. So I was helping people sort of figure out like how to get to their appointment. And when they were waiting, I would sit with them. And I would talk to them, and I would hear about their lives and how they got their diagnosis. And those can be very emotional stories. And yet I would look forward to those. So that to me, it said, this is a sign. This tells me maybe this is what you should do. So then at that point in college, I made the decision, I'm going to go to medical school.
Were there any physicians in your family at the time? Were you the only one expected to be a physician?
No. I don't come from right. My father's an engineer, and I don't come from my mother majored in psychology. She doesn't practice as a psychologist, but I don't come from a background of physicians. And my brother is he's in technology and programming. So that was my own sort of realization that this marries my desire to connect with people on a deeper level, people who may actually be having and experiencing some pain and struggling. There's something there that resonates with me, and that I also enjoy science.
Right. So it's interesting. I just kind of want to add this, that my husband and I are both also from, I'm actually an immigrant. We migrated when I was younger, but highly expected to be successful. That's why we came to this country, and my husband's parents migrated after they both completed medical school. And so I would ask him in the past, kind of playfully, did you choose medicine, or were you expected to go into medicine? Right. And so he's like, it's just what his father did. So then I asked him, what would you have done had you not gone into medicine? And he said technical stuff, like he would have been an IT person, and kind of another stereotypical kind of role. He's Pakistani.
There's kind of the list. I mean, This was like the joke. It was like doctor, engineer, I guess lawyer has been added to that list. It was, and I don't know, business or something, it depends.
There's so many different fields, but he definitely is my tech person. Like when I need help with my computer, my iPhone, anything, my husband takes care of it. So he's definitely smart. So now, just one question. And so how hard was it for you to get into medical school? It's so competitive now. I just wondered at the time.
Well, this was in 2000. I graduated college in 2002. I will say, I'm doing like alumni interviews for undergraduates right now for my college. And these guys have won, like, one guy started a business and is selling dog toys, and he won like a national pitch competition. I don't know how I would have gotten into any of these schools if I was applying now. No. How did I get into medical? Well, it's like test scores and grades, and I don't know. I guess I was a somewhat non-traditional applicant, because I I took a gap year and I actually applied during my gap year. So it wasn't till towards the end of college when I had that experience in that death and dying seminar. And what that meant was I hadn't taken, like I had to take the MCAT test, the medical college admission test. And then I had a year in between. That's when I did the AmeriCorps program. And I did you're familiar with AmeriCorps?
I don't know. Please tell us.
Okay. AmeriCorps is, you're familiar with Peace Corps?
Yes.
I think the name like kind of comes from that, but it was like the program that was started to basically do a year of community work that's sponsored or paid for by the government at like all sorts of places, not for profits. I did a particular type of program. It's called Vista. So the Vista program predates the AmeriCorps program, but now it's the AmeriCorps Vista program. Vista was started, I think, by President Johnson. It stands for Volunteers in Service to America. It was a national program where you would basically get paid a stipend, a small stipend. It's not a lot, but they actually set it at the federal poverty level. That's how much you get paid. Because the goal of the program was to end poverty. And as such, these are not-for-profits that are working on issues related to poverty and housing and other. I worked for a healthcare organization. I worked for an organization that was trying to expand universal healthcare in Illinois, the state I was in, but also nationally. So they're a big proponent of a single payer system, like similar to what they have in Canada, where there are lots of private entities that provide healthcare. Like there's different doctors and hospitals, but the only insurance company is the government. The government is the only insurance company. And in doing that, like, it'd be like if everyone in this country had Medicare. And so they're proponents of that because there's a lot of like overhead and it actually adds so much cost to, like, I don't know if you're involved in billing or your husband's involved in billing. It's so complicated.
Yeah, I understand.
Yeah. So can you imagine if there was just one payer, how much easier it would be for everyone? It'd still probably be complicated, but less complicated.
Right.
And so that they were big proponents of that. And then, that's something I guess I talked about. I don't know. That process was so like bewildering to me. I was like, am I going to get, there were some places that didn't even offer me an interview. And then I got into this place I wanted to go to. I was from Chicago. I want to stay in Chicago. I liked the idea that University of Chicago is on the south side of Chicago, which is, the most underserved parts of the city. And that's where I got in. That's where I went. I was happy about that.
Chicago is where Dr. Kim Williams is, right?
That's right. He was I think he recently transferred, if I'm not mistaken. He was at Rush for many years.
Yeah. I recently interviewed a cardiologist who trained under him. It's just incredible. Just the idea that he was introduced as well. So let's talk about your exposure to lifestyle medicine. So as you know, as we're getting more and more involved in lifestyle medicine, we go to the conferences. I'm always amazed when I meet young physicians, like early in their career, where they now have learned about lifestyle medicine. And I feel like they're like going to be the best physicians ever. My husband's daughter is now trying to get into medical school, and I've been planting that seed for many, many years now about how much more effective she could be if she can teach her patients not only about nutrition, but stress management and all of that. So it sounds like maybe you had an exposure early in your career as well. How did that happen?
Well, so that's the second part of the question. Why lifestyle medicine? So when I went through medical school, I really didn't know. Internal medicine I gravitated the most towards because that's where I found you spent the most time talking to patients. Like at the end of the day, that's what I enjoyed doing the most was talking to patients. And some clinical diagnosis and workup, but that never really excited me as much as like talking to patients. So and there was a lot of thoughtful discussion about the patients too in internal medicine. So I was like, okay, these are my people. And then I went into internal medicine and I didn't really know what I wanted to do. And I became a hospitalist after I finished. And are you familiar with the Hospitalist?
Yes,
Like
yes.
someone who takes care of adults in the hospital. I was an adult
Yeah.
hospitalist.
And I understand the term itself because when I do have guests on the show that are hospitalists, they always have to get that permission to appear on a podcast. Typically, that's what you're talking. Yeah, just to make sure that they're not violating anything.
Yeah. Yes. I used to need. Yeah, I hear you. So I did that for 11 years, 12 years. So I'm not, so it's nice of you to say when I have young doctors on I'm youngish. Thank you. I attribute healthy lifestyle but I've been practicing. I finished residency in 2010. So I've been practicing since then. And most of that time I was a hospitalist. And as a hospitalist, you're taking care of adults who come in with complications of chronic disease, right? People coming in with heart attacks, strokes, complications of diabetes, infections, that runs the gamut. And at this time, I met my beautiful, amazing, wonderful, supportive, so many great things wife in medical school. We went to different schools. We went in Chicago. We both matched out in San Francisco. She's from the Bay Area. And she's a kidney specialist. She did a chief resident year after we finished. And during her chief year, we had our first child, our daughter, who's now 11. And then a couple years later, we had our first son. And then a couple years after that, we had our second son. As we were having children, I was working as a hospitalist. My philosophy on how I ate and how I took care of myself, I didn't really have one. Mostly food. I used food. I would basically use it to treat myself. I would eat whatever I wanted and deal with stress, to be honest. And I had a lot of stress. That working in a hospital is very stressful. And as much as I enjoy, really, I get a lot out of making those connections. That environment it's very intense. People come in sick, the family members are, there's anxiety is high. And then there's just a lot of beeping. There's a lot of things happening at any given moment. Your patient heart could stop and you have to run to their room, or somebody could have a stroke. You have to run to their room. And it's very unpredictable the whole day. So you're often running on kind of adrenaline. And I think when I was younger, that keeps you going. And also eating, then I was just eating the food that they get us for conferences. Back then they would get, Chinese food and with orange chicken and all the, really unhealthy stuff, pizza and pasta and sandwiches. And I would eat that stuff every day. I'd be like, why wouldn't I eat that stuff? They're providing it. I don't have to pay for it. And anyway, to say it took a toll on me. And it took a toll on me physically, but it took a toll on me mentally. I share this on my podcast. I share with your listeners. I have a history of depression that probably I had as long ago as maybe even high school, but didn't recognize the signs and symptoms of it. And then in medical school, I did my psychiatry rotation. And I was like, wait a second. And so I was like, I go long periods, 2 weeks, where I don't want to do anything. And I, stop eating or whatever, all these things. I was like, I check. And I was kind of struggling with it at times in medical school too. It was a very stressful environment. So I self-diagnosed myself, but then I went to go see a psychiatrist and got formally diagnosed and then started a medication, antidepressant. And for the first time in a long time, I just sort of felt, I remember it just felt like things felt normal. I don't know how to describe it more than that. They just felt normal. And it really, for a long time, I was on an antidepressant. And I would have these ups and downs. And, sometimes I tried a different one. Dose was changed a little bit. But now I think there's a role for medication, obviously, in mental health. And I'm not a mental health professional, but I think, so obviously your listeners talk about your mental health with a professional. But go ahead.
Well, if I can share, I get it. First of all, I kind of want to revisit what you were saying about your work environment, because now I know, even though I'm not a physician, that you're around disease and sickness. You're not at a wellness center. You're not in a place where people are meditating, taking deep breaths, and presencing themselves. You're in a highly intensive environment. And my husband still works at 2 hospitals, so I get. And, the calls, I get it when he gets the calls and an emergency and all that stress that comes about. So you have that going on along with nutrition, which now we know affects our gut, which can affect, there's that connection between the gut and the brain. I once heard a celebrity, and I don't remember his name, Jonah Hills. I don't know his name, but he had a significant weight loss experience. And he said that he realized one day that he was eating like a 5th grader at a birthday party. that was his diet. And when he made, he had that awareness, he made the change, and now he's living very healthy. I appreciate that you're bringing up your battle with depression. That's an important topic that we cover here on the podcast as well, about mental health. I too, many years ago, suffered with depression and did the antidepressants as well. And until I started doing more internal or inner work. And, but I'm same way. If you need to get on the medication to get you started,
that's right.
That's a wonderful way. And so then the medication started to help you normalize, you said? Like,
it started to help me normalize, but normalize like I could, normalize my mood. And in a way, just kind of, I'm not blaming, medication helped me a lot, but I didn't change my other lifestyle habits. It wasn't like an impetus to like, it was like, oh, now my mood's okay. I can kind of go back to doing the stuff I was doing and do it better. And so I bring all that up to say that, like, once, I think when my middle son was 9 months old, and then my wife told me she was pregnant, and that was like really intense for me. Like, I felt like work was so stressful and crazy. And then when I come home, like, we had 2 small kids, and now my wife was saying we're going to have a 3rd small kid, and which was really awesome. It was a blessing. I mean, it took me a minute to get to that, but it was also felt very overwhelming. And my wife will tell you, when I would come home at those times, like, I wasn't in the best of moods. I would, I don't know what the best word, I was like Oscar the Grouch. Like, I'd basically just complain about things that happened during the day, how busy it was at work, what this patient's family said to me, what this, I'm just looking for, I think I was just looking for empathy or for support. I don't know. But regardless, I was living in my head, and I was dumping my head and onto everyone else. And one day my wife said to me, she said, you come home, before you come home, we're usually in a good mood. And then you come home and you're always so upset, and you're always so tired, and and she didn't know how to tell me, actually, because she knew that I might react to that. She was actually probably a little worried about telling me. And my reaction to that would be like worsening depression. Like, I would sort of go to our room and like seclude myself. And so she told me that, and she told me, I said to her that time, I said, I don't have a choice. All day, all these things are happening. It's so stressful. When I come home, this is when I'm allowed to do these things, complain or whatever. I'm allowed to be this way. And then that's when she asked me, she said, how is it fair that the people you supposedly love the most get the worst version of you?
Oh my God.
I know. And I didn't know how to answer that. I had to sit with that. But I found, when you sit with it, and I legitimately asked, like, the universe, God, for help. And that's when this physician wellness talk got in my purview. It was scheduled, and I went to it. It was after work one night. and it was called Evidence-Based Workplace Happiness. And it was all the things you can do to be happier, which initially when I heard that, I was like, that's not even a thing. Like you don't choose to be happy. And Maya, guess what were some of the things? I bet you know. What were some of the things that came up at this workshop?
In terms of finding happiness, I'm assuming that maybe the workshop incorporated learning how to laugh a little bit. I don't know.
Yeah,
or spending
laughter.
time in nature.
Spending time in nature. I don't know if they talked about that, but that's a really good one.
Yeah. I assume that maybe journaling, or I don't know.
Some sort of mindfulness practice.
Yeah.
Yeah. I mean, journaling is one way to do that. And they talked about mindfulness meditation. They talked about gratitude and having a gratitude practice and just saying thanks to people, like genuinely telling people why you appreciate them. And all these things were like, they had us pull out our phone and text somebody we work with, a reason we appreciate them. And I texted my office mate who's senior to me. And I just told him, I really love getting advice from you. And it's really great, like having an office mate who's also a good friend or something like that. And then they said, how do you feel? And I was like, I feel better. Like, what is this magic trick? And what else can I do to do? And so then I started pulling over on the side of the road and doing Headspace 10 minutes a day. I just downloaded the Headspace app and, because they recommended that. And I was like, okay, I'll do that. And then my wife, within a few weeks, she said something to me unexpected. She said, there's something different about you.
Wow.
And the difference was I was trying to I was recognizing all the thoughts I was having from the day and all the things that bothered me. And as Andy on Headspace was helping me sort of let go of those things and notice them and not judge them, and then take some deep breaths, and I was down regulating my body. And then I was coming in the door for 10 minutes. I was doing that. And I was excited to see my children. I was excited to pick them up and give them a hug. I was excited to find out what they did that day or what my wife did that day. Like, my mindset went from being stuck in my head to being out in the world that I was living in. That's the change I made. And I didn't have any presupposed expectation of what was going to happen. Actually, when I would sit and meditate, I'd be like, why am I doing this? This feels weird. I don't like this. And luckily, Andy says that. He says, this is going to feel weird. You're not going to like it. Because if they didn't say that, a lot more people would give up. But that's a small change. Small change, I'd say 10 minutes, small change. But I started noticing difference in then my relationships at home. I started noticing a difference in my relationships at work because I started looking at work differently. I thought about my colleague who I texted, and then I started thinking about who else is here that I get to work. If I get to work with a lot of my friends, that would be a better experience. So I started to get to know people more, and yeah,
it sounds like, wow, it's such a beautiful story. So many key points here. One of them that I want to bring up is Headspace, the app that you use, because I recently did a series on my Thursday Maya tip health recommendations that I make. I went through the pillars of lifestyle medicine and made recommendations for heart health. And one of them was using apps such as Headspace to get the support that you need to quiet your mind, or whether it's Calm or whatever app to do the deep breathing and all of that. And it sounds, Dr. Rock, like you needed support. Like maybe you were experiencing burnout as well, do you think?
Yes. Yes. I think so. That's depersonalization and the feelings of emotional and physical exhaustion. Like these are things I was definitely feeling. And it's interesting because the meditation sort of reminded me over time. I started remembering why did I go into this? Oh, I like connecting with people. Somewhere along the way, I lost sight of the fact, as stressful and as hard as being a hospitalist is, the thing I miss about it is you had literally unlimited time. If you needed to spend an hour and a half with a patient to talk about something, you could. You would just see that patient in the afternoon and then kind of check in on everyone else. You could sort of triage in that way and give people more time if they needed it. And that's no other like in a clinic, you can't do that, right? Everything is scheduled. And so that was cool. But anyway, yeah, I took meditation and I created a space. I would say this, I created a space before I got home where I allowed myself to sort of sit with these thoughts. Like, how did today feel? Like, what was hard about today? And then as I noticed my life, my relationships changing, my experience at work changing, I think I also recognized, like, what else am I choosing to do right now that may not be in my best interest? And it was clear my health was, like, just from a physical standpoint, my weight had just been going up and increasing. And to the point where I didn't even know how much I weighed. I was like, that was something I didn't want to know. I was kind of afraid of that. I hadn't gone to see a doctor in years and so then when my wife told me I'm having a third kid, I started meditating, started thinking about it. She's getting closer to the due date. It wasn't until after he was born that I went to go see my doctor, and my doctor reinforced what I was, my blood pressure was high, my weight was such that I had obesity, and then he wanted me to get labs checked, and I was afraid to get the labs checked, but I said, I got to do something. And, there was the universe hearing me again. There was a doctor from the hospital system I work in who came for medical grand rounds. And this was, he comes and he tells the story of how when he was 40, he had a heart attack. He didn't have a heart attack, but he had chest pain. He was dropping his 2 young kids off at school. He goes to the ER and then they tell him, you need stents. And he gets stents and he goes on the American Heart Association diet. And then 6 months later, he's at the gym and he gets chest pain again.
Oh my God.
And he goes back and they say, your stents have closed off and there's new disease. And now you have to have bypass surgery. And has bypass surgery. And he says, how is this happening? Like,
oh my God.
He was eating like lean meat and olive oil and veggies and fruits and exercising. But then he did his own deep dive in the research and the literature, and he discovered a whole food plant-based diet and discovered how it has the power to reverse vascular disease and heart disease. He said, how has no one told me about this? And so he started eating that way. He started educating his patients about that. And then he took it on himself. This was in 2015 to travel to every medical center in Northern California. This is the Kaiser system, every medical center. He encouraged everyone to eat this way, a whole food plant-based diet. The medical center was sponsoring a 3-week challenge. I signed up for it, but I couldn't bring myself to do it because it just seems so different than what I was used to eating. And yet I knew that something needed to change. And so I started doing, eating that way, doing meatless Mondays is what I used to call it back then, for once a week I did that almost for a year. Actually, it was about a year because the challenge came back a year later. And then I felt ready to do it. So in that year, I learned how to make, plant-based meatloaf and plant-based, I learned about soy curls. I mean, I needed that stuff because I was coming from, first of all, really liking meat and eating it my whole life, and worried that I wasn't going to enjoy food. And then when I started realizing, no, actually, like, this is so tasty. This is so tasty. But I was only doing it once a week, so it didn't really have a big impact on me. I was eating all the other same food. But when I did it for 3 weeks, I finally went and got my labs checked. I had prediabetes and my cholesterol was high.
Wow.
And I just ate this way for 3 weeks. I had a whole plan because I knew which recipes I could make and all this. And then I got my labs checked again, and I felt great, first of all. I mean, the first week was like a little, I'd say, like withdrawal. and then by the end of it, I felt really good. I was sleeping better. I felt like I had more energy. I wasn't exercising at that time, but some things that happened, my prediabetes reversed in 3 weeks, which is faster than,
Wow.
So my blood sugar, my LDL cholesterol dropped 40 points, and my resting heart rate went from the 80s to the 60s.
Mm-hmm.
And this was not from increased activity. This was from my heart getting better blood flow, which that blew my mind. So I was wearing a Fitbit at the time. So I started eating that way like 80% of the time. And I won't get in, it took me several years to finally like learn like, okay, this is the food that makes you feel good. And there are ways in which you can eat it that are really enjoyable. So just keep doing that and let go of the stuff that, you thought you loved. There's a process by which I work with patients, you get disillusioned by it.
Mm-hmm.
And that's, I think, what finally started to happen after 2, 3, 4 years where I would sort of like, oh, I really want that In-N-Out cheeseburger. Like a year or two eating this way, I'd be like, I'm going to allow myself. And then I would eat it and I would be like, oh, I feel terrible. Why did I eat that? Oh, because you thought you wanted it.
It's amazing that before you made the change, you didn't feel that awfulness like you do now when you clean up your diet.
Yeah.
And so these changes in your numbers, in your biometrics that you just told us were mainly as a result of just nutrition. Changing your nutrition, not even exercising yet. That's so awesome.
So I just kept going, and then within I used to get stopped now I didn't make these changes to lose weight. I had kind of decided I was a bigger kid. had kind of slowly gained weight. I was like, okay, you're probably just a bigger guy. And I made these changes because I started to focus on my health. I said, I really need to be healthy for these children. And that's, I think, the space that meditation allowed me to recognize is like the choices I'm making. They're not in alignment with the type of person I want to be. Well, who do you want to be? And so once I started sort of exploring that, I was like, well, then something needs to change. And then universe heard me and said, well, this is what you need to do. And it took me a year, but I started eating that way, noticed all these changes. Weight just started coming off then. And not everyone has this experience, but a fair number of people do, because you just start eating a lot of foods that are really high in fiber and really high in water. Like you end up eating less calories. I wasn't counting calories. I was just focusing on eating, broccoli and potatoes and beans and rice and things like that. And then within a year or two, I started asking the question, why aren't we doing this for patients? Like this was like 2017. I was like, literally, like I would meditate on that. Like, why aren't we doing it? I didn't know about the American College of Lifestyle Medicine, believe it or not. I decided in 2017, one day, a couple years in, to send an email to that doctor, Dr. Rajiv Mesquita in South Sacramento. I said,
I know who he is. I met him at Plantrition in 2018, and I knew about the lifestyle medicine practice.
That's it.
Yes. Oh my God. That's awesome.
Oh my God. He had such a big impact on me. And so I wrote him an email. I just said, gratitude. I just want to tell you, your talk changed my life. I am not going to have a heart attack when I turn 40 because of you. And because I was 36, I think, or 36. Yeah. When I saw him speak. And so that was just sort of, I used to think I think back, I would have become one of my patients in the hospital. And he advised me, he said, there's a certification in lifestyle medicine. 2017 was the first year. I had missed that, but he said, next year you get certified in lifestyle medicine. I got certified in lifestyle medicine. He said, well, he had created all these programs in South Sacramento. And so we brought one of them to our medical center in 2018. And that program still continues to run. At a certain point, 2019, I said, I want to do this 100% of the time. And then the pandemic came. And I was a hospitalist. And I said, you know what? Society, the universe is telling me I need to do this right now. And so for the first year and a half of the pandemic, I did my hospitalist job. It was like glaring at me, like the people getting admitted to the hospital were people with chronic diseases that were caused by lifestyle factors. And so I couldn't ignore it any longer. In 2021, the summer, I decided I'm going to do this. What I ended up doing was going into primary care for a year. So I stayed with my organization. I went into primary care for a year. I became the director of lifestyle medicine. That was an inaugural position that was created. And what I realized a lot of things, but I realized that our current system is not really conducive, unfortunately, in many respects, to providing this type of care, to providing like because lifestyle counseling really relies on having deep conversations and connection and getting into things like why it's difficult for people to make change, what their history with food is, their relationship with food, perhaps some history of trauma that might be affecting their ability of change. We don't even have time to ask about these things, much less talk about them in clinic visits. And most of, I don't want to get into all that right now, but most of our current medical system is really focused around managing illness. It's focused around identifying and then managing illness, not preventing and reversing it. And so if your goal is to manage illness and there's wildfire of poor lifestyle habits that are causing all this disease, and you're just managing disease, then at a certain point, the system won't be able to handle the amount of disease that it has to manage. That's not a sustainable system. And that's what we're seeing right now. We're seeing so many parts of the system buckle under this epidemic of chronic disease. Mm-hmm. So in an effort to change the system, I decided to go work for a lifestyle medicine startup. And so last November, I joined the team at Mora Medical. You can find us at mora.com, MORA.com. And Mora was started by Dr. Lori Marbus. Lori Marbus, she has history of starting plant-based telehealth in the past. This new company provides lifestyle medicine care virtually, both physician visits, but the care is really centered around multi-week disease reversal groups. We call them circles. And so these are physician-led or sometimes physician assistant-led disease reversal groups that meet for several weeks. They actually meet for 10 weeks, and they're centered around reversing chronic disease. So developing good, it's the pillars of lifestyle medicine that we go through, but there's an emphasis on whole food, plant-based eating. Mm-hmm. And what I liked, and we accept insurance, we accept Medicare in California where I practice, although I'm now licensed in other states as well, because we're now in 5 states. We just started in New York, but we're currently in Texas, Florida, California, Ohio, soon to add Colorado. So you go to our website, you'll see, and even if we're not in your state mm-hmm. yet, we're maintaining a wait list because our goal is to continue to expand across the country. And what I like to say is we're democratizing lifestyle medicine care, because right now you just by chance may have a doctor who knows something about this. It's still a very small percentage within medical community. Or by chance you may be in an area where you can see someone. And some of the services online are quite expensive, $150, $200, $300 a consultation. Some private doctors are doing that. We've been, our company is set up around, these are medical visits, they're group medical visits. So we work with your insurance. You get billed your copay. And if you don't have a copay, then there shouldn't be a cost to you. We're working to accept most insurances, but that's a process as well. But we have quite a few that we've already been able to secure contracts. So yeah, who are we reaching out to? People with chronic disease who want to reverse their chronic disease with lifestyle changes, which is many, many, many people.
Yeah. And it helps, a couple of points there as well. It helps to know that you've gone through the process as a patient in understanding, how your mood has been affected by, say, poor lifestyle choices, for example, or even the nutrition. You've gone through all of this with stress, dealing with stress and burnout.
Yes.
And you've seen the results of implementing these pillars into your life. So it feels so good to know that we can work with a physician who has that understanding, who probably is more likely to be compassionate with us as we're making.
Absolutely.
Yeah.
I get everything. I get food addictions. I've had some of the worst food addictions. I get, there's nothing that anyone does where I'm like, oh, that's, there's no judgment here, because I feel like I've either done those things or, so that I agree. Actually, that I often will connect with people on that, which isn't typical. I don't think most doctors are typically sharing their experience with depression or with eating disorders or with food addiction or things like that.
Yeah. It's actually kind of discouraging, Dr. Rock, when I've tested out doctors and I see that they're in bad shape. The last thing I want is for them to try to give me recommendations. So, and I don't want to be judgmental about it. I'm just saying that sometimes doctors are the worst patients. They don't take care of themselves. So we really appreciate what you're doing and the fact that you're licensed as well, especially here in Texas, we get a lot of people always asking, they want a doctor that's on board with this way of living. So that's great. And we also have spoken in the past about telemedicine and the benefits of having telemedicine, because it's still that's one of the gifts that the pandemic gave us, in the sense that some of those things moved to the comforts of our own homes. So we can now see our doctor here at home with a little bit more of an extended visit, rather than that 15 minutes that you're lucky to have when you do an annual visit with your primary. That's awesome. Is there anything else you'd like to share with us?
I do want to share my podcast. Oh, if I might, for a minute.
Tell us how you got started with your podcast. Yeah, that's a component of your work.
That's a component of my work. It's an unpaid component of my work.
An
extension of my work. And it's something I'm really passionate about and I feel really good about. I enjoy it. And what do we do? So it's called The Health Feast. The Health Feast. You can find us at thehealthfeast.com. You can find us wherever you get podcasts, most places where you get podcasts, I'm sure. And it's myself, Dr. Rock, and I co-host it with a friend of mine. His name is Poe, Tapotu. Poe is someone I was connected with. He actually did an immersion program, one of the Plantrician immersion programs in Abu Dhabi. He applied and was accepted to be on a reality TV show that I think is going to be released later this year. And after he came back, he lives in the Bay Area, north of San Francisco. His doctor who I did residency with, who I haven't talked to in years, she messaged me online on LinkedIn and she said, he needs the support of a lifestyle doctor. And this is how I also know I'm doing my calling or following my calling, is when I hear that. I was like I called him, that day or the next day. I was like, how do I connect with this guy? Because that's what I want to do in life. I want to support people to make lifestyle changes, because I've experienced the power in my life, and I've experienced the punishment of dieting. Like, I lost 30 pounds for my wedding by forcing myself to just eat less and run, and I hated running. And then guess what? Right after my wedding, within a month or two, I gained more weight, all of it back and more, because that was a punishment. And so what I've learned is there's a way to honor your body and your needs and to treat yourself with kindness and compassion, where you can enjoy the food. It's delicious and it supports your best health. Yeah. So it doesn't have to be either or. It's a health feast. Because when we think of a feast, we think of like the best things and things that are super delicious. When people think of health, they think of boring or punishment, or that's not the way it has to be. Health can be a feast. And so we want everyone to experience that. And so Poe and I talk about our journey. He's still figuring it out. I'm still figuring it out. And that's where it's been going on for a couple months. We're starting to have some more guests on now. So it's check it out. Yes.
Yeah. Well, awesome. We're going to add a link in the show notes for anyone who's interested in listening to your podcast. I really like what you bring to the table today, Dr. Rock. The fact that, you overcame, it could be very debilitating to suffer with depression and physician work, burnout as well. So I appreciate that you found a way out of that, and your wife played a significant role. So congratulations to her as well.
Absolutely.
Many of my listeners are women, and I like to support women in health, but I always say that the reason I want to encourage women is because we are the ones that bring this information to our homes, to our family, our families. And so she clearly knew something and supported you in that. So it's wonderful.
Yeah, I can't say enough good things about my wife. Is a nephrologist. She works full time as well. And for many years, I was a hospitalist, and I worked 2 weekends a month, and I was gone certain nights. And I think that happens to women a lot. Like they have a career and there's the expectation that they are the primary manager in the family too. And that has changed a lot in my household. And that's been through deliberate conversations and kind of a better understanding on my part.
Wow.
Of not, I was living in my head. I'll say it again, but it's not an excuse, but it's to say, like, now I drop, and I love it. I drop off my kids at school every day and we do a gratitude practice in the car. What are we grateful for? Sweet. And what are we excited about for today? And that's like one of the highlights of my day is doing that with them. So
awesome.
Yeah.
And then I'm going to bring this up because I had a meeting today with the women's group that I'm part of for ACLM. And there's, have you ever heard of the Stress-Free MD, Dr. Robin Tiger?
Yes.
Okay.
Yes.
She's coming back. She's been on the podcast. She's coming back again. And this time she's going to talk about how she partnered with another physician to develop the first ever physician coaching program in lifestyle medicine, specifically to address physician burnout. So I'm going to tell her about you as well. You might want to be on her podcast as well. She lost, during the pandemic, she lost colleagues to, I don't want to say the word, but self-harm, because sometimes you get, but, she made it her mission to really support physicians. That's what she's all about. And I was like, you have to come back on the show and talk about this. It's so important for us to see our physicians as human beings and to be compassionate as well, and to support our physicians, and to maybe from some time to time when we visit our physicians, just to ask them, how are you doing today?
Yeah, 100%. I'll look forward to listening to that. And that sounds like someone I would love to connect with. Thank you.
Absolutely. So as we're wrapping up, is there anything else that you'd like to share with our listeners? And what's the best way to get in contact with you? You gave us your podcast as well.
You can, on our website, thehealthfeast.com, you can submit questions for the show. You can sign up for an email list. I'm on Instagram at Rock Your Life. So I go by Dr. Rock, but my first name is Rakesh. So R-A-K is Rock is my nickname and also my doctor name. And so it's Rock Your Life, RAKYOURLIFE, that you can find me on Instagram. And anything else I'd like your listeners to know, just that, good health is an opportunity. I say it all the time. It's an opportunity to feel good. It's an opportunity to live the life that you actually want to live. And when you start looking at it that way, and you start realizing that, you can do it yourself.
Yeah. Well, I can't thank you enough, Dr. Rock, for two things: for taking your time from a busy schedule to, speak with our listeners, and also just for sharing your story and being so vulnerable in that as well. Thank you again.
I appreciate you having me on your show. This was awesome. And I wonder, will you come on the Health Feast?
Yes, that'll be fun.
Okay. All right.
I'm not used to
then we're going to make that happen.
Yeah.
Yes. I love that. Okay.
All right. Thank you.
All right. Wonderful. Take care. Goodbye.
Goodbye. You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave us an honest review on Apple Podcasts. That helps us to spread our message. Thanks for listening.